Hi guys, Dr. Meri Rosco here. We have a lot of patients that come to us with disc bulges or disc herniations, and very often we'll prescribe a therapy called decompression. So today I just want to briefly touch on why we prescribe decompression and how it can help that nerve, how it can decrease your pain. So right here is a model of a spine, and you see the bones in white going down, that's your vertebrae. And then in between you have these cartilaginous discs. Those are the discs that we're referring to when we talk about disc herniations or disc bulges. What they do is they keep that spine separated and they keep pressure off of the nerves, which you see here in yellow, that are exiting at each spinal segment. Down here where this red spot is, that's an example of a disc herniation. So as the disc starts to break down, or you might hear the word degenerate, what's actually happening is it's getting dehydrated, it's losing nutrients, and that disc is getting smaller and smaller. So the part in the middle, called the nucleus pulposus, can actually squeeze out the side and hit the nerve. That's going to cause pain, and it can cause decreased function. So what the decompression therapy does is it targets that specific disc, and it puts a little force in both directions, pulling up and pulling down at the same time. By doing that, it's helping that disc to rehydrate, bring in nutrients, and build that height back up. So the hope is that this herniation gets retracted a little bit, gets pulled in a little bit, so it takes the pressure off of the nerve. It's not going to go back to a healthy looking disc, but the goal really is to just decrease your pain and improve your function. So we just need it to go back in enough to take that pressure off of the nerve. So you'll notice decreased pain, and like I said, improved function, which is usually if you have a weakness. So say it was the L4 nerve, you might notice some weakness in your quad muscle, the muscle on the top of your thigh, either on your own when you're doing squats or running, or maybe when the physician tested, right versus left, you noticed that one side was weaker than the other, or when they used the reflex hammer on your knee, you might have noticed that the reflex was weaker or diminished on one side versus the other. So you should start to notice over time that this starts to improve. I'm going to continue to talk about decompression in other videos. So if you guys have any questions or you want me to go over anything in particular, just put it in comments and I'd be happy to do so. Thank you.